In fact, that ways MUHS was very smart. I mean, they have really had this hub and spoke model where people have made models with the HoloLens. So many is getting added on, and actual realistic thing has started to happen.
Yeah, because RGHS, Vaidehi has come up with this
very nice
new pattern, but the cost is the embargo here, as you said. So the cheaper, sir, please. That'll be great. I think the students, it may make sense to be, moving fast into it.
Sir.
By the time we make it, may take another 3 years, 4 years.
Sir. And in the interim, maybe we can train our educators so that they can be ready to be compliant with it. Thank you, sir.
Please, sir.
Am I disqualified from asking a question?
Not at all, sir. Please, sir.
Okay. So, no, I must compliment for a wonderful talk, but that's the homework. But more importantly, I think there is a very valid point which has been brought out by him. Actually, we are trying to look at this technology and trying to think it will solve everything. So I think everything has a place. And when it comes to complex scenarios or complex, like that matrix was shown, for example, in the armed forces, specifically, or if you're looking at a very rare situation to be practiced and done 3D realism, putting an IV cannula is not what these tools are for. These tools are, suppose if you want to practice 6 people trying to evacuate a patient from maybe an accident site to an ambulance. So these are what these skills are for, and I think we have to take it in that context where you can't really practice these things day to day. You have to fill a gap. Putting an IV is not the gap. So the gap here is actually looking at these complex scenarios, like in the army, if you want to say, I want to practice in an urban warfare, and I want to fire, and I want to move around in a room, and I want to use sort of augmented reality. So that's where the gap we need to identify, and that's where it's so important that the doctors drive technology rather than technology driving the doctors. So that is very important.
Thank you.
And that could be last question, please. Yeah.
I'm Tarun, and I have my own startup in AI in IIT Delhi. So one of the questions, and I always debate with my fellow people at VR, is how close are these models with the real world situation? For example, at many, so I come from a family full of doctors. My parents are from AIIMS, New Delhi. At all these institutions, they tell you to how to write a prescription. I'm just giving an example. It has to be capital letter, it has to be generic, many other things. When I went to these hospitals myself, in general medicine, you have 500 patients, 3 or 4 doctors. And what they do with prescription is everyone knows. So what I'm trying to tell is, for example, cricket example, you practice, but real world situation when there are 1 lakh people watching, what goes in the batsman's mind is very different than what you do in VR, actually. So how do you think, ma'am, that these models can come close to the reality so that doctors are actually adapted to the real world, how it's going to be because of the patient load or other situations? Thank you so much.
Thank you for the comment. Actually, I would just like to say that this is for us to decide as to where we really need to have an interface. And if we need to have an interface, we can't live in silos. I can, I would like to say for myself that if I want something to be done, I can't be in my own silo as a doctor, because as a team who's developing it for me, like maybe, as a startup, when you want to understand, you would like to understand what exactly I want it for. And if I'm not clear about it as to what all features I want in it, what exactly should be there, how often it should be done, how much should be the time that it should take to assess or maybe to load that information, I can only talk about the doctor's side, then we are a failure if we want to adopt a technology without understanding that technology. That's all I would like to say. You are the stalwarts, you can actually make it, but it will fail if we have not asked for what we want. And that's where that game product design is very important. And we should understand what exactly do we want. So, and maybe time has come slowly. I heard some courses have started. One is also there in MUHS. Slowly, this training will happen where undergraduates and postgraduates will be ready to actually demand or ask what exactly they want.
I humbly submit that due to positive time, it would be difficult to take any more questions. Ma'am, thank you so much for such an great talk. I would invite you to please collect your momentum. Thank you, ma'am. I would now like to invite one of the founding fathers of FEMA medical education, an illustrious figure in GI surgery, Professor Emeritus at GS Medical College and KM Hospital, Dr. Avinash Supe, a very well acclaimed figure in medical education in the country. So I had kindly considered to come and deliver this talk on AI simulations.
It's a
He actually is a B.C. Roy National Awardee. He has also been awarded by the National Board of Examinations, and is also an MMC awardee.
Sure. Thank you.
Welcome to you, sir.
Thank you, Dr. Makhani and Karuna for a wonderful talk. You really led the line for me. I'm also going to talk about AI in simulation, but there will be some amount of repetition, reinforcement. But I'll also talk about virtual patients and the science behind all this. Can I have my slide first? Thank you. It's always a pleasure to come to AFMC, and this hall is very nostalgic because I've given so many talks here. I would like to thank many people, also the Colonel Day. Now, I always believe I'm an Apple fan, and I always feel Steve Jobs, market research and iPhone, our task is to read things that are not yet on the page. And anybody who has seen 2007 when iPhone was introduced, I think it goes that what was a phone for communication has become a computer in our hand. So it completely changed the way we looked at mobile. So artificial intelligence has already entered our life. I mean, all of us talked about all this. People talked about movies, people talked about Digiyatra, people talked about space, everything. We every day deal with artificial intelligence today. If you look at PubMed, there are about 263,000 more than that publications in last 8 years. Just imagine how many publications. Why people are so much talking about this. And everybody talked about AI and ML, you know, the three concepts which have come over last 50 years. Now, when you talk about AI in simulation, it involves using AI techniques to create realistic, I'm not saying realistic, it is real, close to realistic, data-driven simulations which mimic real world. Now, basically AI has basically four purposes. Enhance learning, you learn decision making, that's all knows how. Predictive modeling across fields like medicine, engineering, aviation, and military training. So when you look at AI in simulation, there are various kinds of simulations. One is predictive simulation. Second is interactive simulation. Third is a behavioral simulation. And fourth is an immersive simulation. Now, when you say predictive simulation, use AI to forecast possible outcomes. You know, this is something which is very important, like weather forecasting, you know, financial modeling. AI weather forecasting has become very common today. In fact, AI for science, predicting infectious disease. Today we are talking about infectious diseases, how they are. This is paper from 2024, predicting monsoon outbreaks. Now we get in Mumbai a lot of monsoons. So in fact, when I was a dean 2016, we started the first AI model to look at the dengue outbreaks based on the type of pattern of the monsoon. So what we did last took 50 years of the monsoon data and we put it into AI and we did data analysis and we found out how the dengue outbreaks are going to be based on the monsoon patterns. Very interesting. One of the person did PhD on this. It's a big data analysis. It's a published paper. Artificial intelligence is used for predicting preterm births, estimated fetal weight, predicting successful vaginal delivery. Artificial intelligence in predicting post-operative surgical complications. This is all predictive simulation. You create a situation and then you work on this. The second is interactive simulation, which I think Karuna showed quite a bit, I think. Allows real-time interaction between users and simulated environments. It's a virtual training for pilots, surgeons, especially if you see the Sully movie was a very classical movie about the interactive simulation, like say AI Harvey, cardiopulmonary resuscitation simulator. This is all, it's kind of interactive simulation. Autonomous robots today have come and they are talking about surgical precision using AI. In fact, AI simulator for training brain surgeons, these are all now available. And look at this AI simulation in obstetrics. This is using, somebody is using HoloLens 2. But I must tell you, HoloLens 2 is now out. There's much more is coming ahead. But look at this. You can put on sound. I'm sure there will be a lot of things which will be there. And you will find the way people now do deliveries.
CME Healthcare selected shoulder dystocia as the first scenario on Lucina AR because it's a rare complication of delivery, but it's one that's difficult to manage. You have a number of options. You need to think fast. Seeing the anatomy, seeing the progression of the baby in the birthing canal, and seeing where the shoulder gets stuck is going to be very helpful to understand how to fix it. Seeing them in front of your very eyes as a student is like a revelation, right? This is the future of healthcare education.
And see, here you are seeing the students are doing it. They have problems, put it into this, and they are explained about this. Now you will find, look at this behavioral simulation. This is the new world of AI simulation, where if you look at this artificial intelligence in behavioral and mental health care. Now, this was considered to be an area where there is not much of artificial intelligence, but today it has come. In fact, if you look at this, how they have trying to focus on simulating the human and animal behavior. And they now called Lancet, published this paper of digital mind, AI-informed mental care, promise to practice toward the realization of AI-informed mental health care. And in fact, they developed this whole model of how you can AI augment the mental care pathways. There's Amruta Vishwa Vidyapit, who have now 95 more than virtual simulation. This is from India again. AI is now extensively used for communication skills. Now there are she showed Sarah. Now there are so many Indian versions have come, which are now trying to teach you, and they're the health communicators. So we have gone much ahead than what we really think about this. The third type of simulation in AI is what is called as an immersive simulation. I think Karuna showed some of the examples, military drills. And now look at this doorway to future. Now look at this kind of an immersive lab. This is in India. This is from GSL, Rajmundry, in one of the corners of the Andhra Pradesh. You have now a student can see, he can touch, he can rotate everything. I mean, you look at this kind of a training he's going to do, then I'm sure he will have a better understanding. I'm not saying he will have completely haptics. The haptics is coming. Look at this advanced robotic with AI-driven technology. Now, clinical application of artificial intelligence in robotic surgery. They will show you where is your dissection plane. The AI will guide you during the surgery. Now, if I do this same patient CT, I put it into a particular kind of a focus. It will help me to know which dissection plane I'm going to operate. And next day when I'm operating, it will tell me how I can operate in that particular plane. It will guide me through that particular thing. Now, these are something which I call are advances which have come for the help of the clinician, which will help me to do better patient care. And now these are not very difficult to do, I mean, I can avoid injuries to various nerves, vessels, which is very, now the new thing like colubrics, where now endorobotics have come. Endorobotics now help you to do with two links, and they can really operate. They can operate anything. You can suture, you can do a rolling stitching. I mean, all these now can be manipulated with the help of AI with minimal amount of thing.